Welcome to Report from Washington with your Congresswoman EBJ Johnson. Each week, your representative invites policy experts to join her to discuss the issues that affect you the most here in the 30th District of Texas.
So I rise in strong support of H.R. 362 for 10,000 teachers and 10 million. This legislation is designed to strengthen our nation's scientific competitiveness. We do right and good by this country. When all of us assembled here this evening understand the magnitude of this moment. The time to act is now.
The Pledge of Allegiance will be led by the gentlewoman from Texas, Congresswoman Johnson.
And now, Congresswoman EBJ Johnson reports from Washington, D.C.
Hello and welcome to the Capitol Report this week. My guest today is Rhonda Richards. She's a senior legislative representative for long-term care and chronic care issues at AARP. She and I will be discussing elder abuse and other long-term care issues on today's show. Ms. Richards advocates on long-term care issues like nursing home quality, long-term care financing before Congress and the administration. She joined the AARP in 2005. Prior to that, she was a staff director for the Senate's Health, Education, Labor, and Pensions Subcommittee on Aging. She also worked for Senator Barbara Mikulski, and she is a graduate of Bryn Mawr College. And I'm so delighted that she took the time to come and visit with us a bit this morning.
Thank you, Professor.
Welcome. Tell me a bit about the status, pretty much, of long-term care now. I know a number of seniors are staying in their homes as long as they can. But when they cannot any longer, how do they pay for going into the homes?
Sure. And thank you, Congresswoman, for inviting me to join the show today. When we talk about long-term care, as you mentioned, people really do want to stay in their homes. About 89% of people who are age 50 and older want to live in their homes as long as possible. And they get lots of different kinds of services, from help with eating and bathing and dressing, to help with transportation, assistive technologies and devices to help keep them independent, modifications to their home to help them be able to live at home. And when they're not able to live at home any longer, they may go to some other settings in the community, such as adult foster homes, board and care homes, sort of small homes where several people who, like them, who may need help can receive services. They may also go to assisted living facilities, where they can have some help with daily activities, have their meals prepared, their medications, someone help them make sure they get their medications, etc. And then sometimes they may also go into nursing homes when they need a higher level of care and more assistance with their needs. To pay for a long-term care, most often it's actually family members and friends and neighbors who are providing them with care, especially at home. And if you try to put a dollar value on the amount of that unpaid care, it's about $375 billion a year that these families and loved ones are providing to their family members. When families are not able to do it on their own anymore, oftentimes people may pay out of pocket. Medicaid, which is a federal state program that provides health and long-term care to individuals with low incomes and low assets, is the largest payer of long-term care. It pays for about 49% of long-term care. Medicare covers a little bit of long-term care, some limited home health care, and skilled nursing care. But in general, Medicare does not cover long-term care, and that's actually a popular misconception that people have, because people think Medicare does cover long-term care, and it generally doesn't. People also may have private long-term care insurance that they purchase that pays for the services that they need, but they may also use their savings and pay for it out of pocket or through other public and private resources. But once they've exhausted their own resources, they may find themselves applying for services and help through Medicaid.
So it helps to have long-term care insurance.
It can help to have long-term care insurance. Not everyone is able to have long-term care insurance because it's not always affordable for everyone, and if individuals have pre-existing conditions, certain health conditions and things, they may not be able to qualify for the insurance. But in general, if individuals are looking at long-term care, purchasing long-term care insurance, it's often less expensive if you buy it when you're younger than if you wait until you're older to purchase it. So it can be helpful for some people. It's not necessarily right for everyone, but it's something that individuals can certainly look into and do their homework on to see if it's right for them.
People are living longer, and most are living longer with a few frailties. What do you consider the proportionate number that might be in homes versus nursing homes?
Sure. In general, looking at older adults and also younger adults who may need assistance, in general about 8 in 10 people are actually living in their homes or communities and receiving services. There was a study done a few years ago that looked specifically at older adults who received long-term care services, and it found that about roughly a 3-to-1 ratio of adults, about 4 million older individuals receive services in the home and community, and about 1.5 million receive services in nursing homes. So there are definitely more people that are receiving services in their homes and communities than in nursing homes.
Now, they have to be totally out of their personal assets before they qualify for Medicaid?
Yes, they do. For individuals to be able to qualify for Medicaid coverage of long-term care, and the actual eligibility criteria for Medicaid will vary by state. So it may be different for someone in Texas than someone in Oklahoma, for example. But they would have to meet certain criteria, including having their income below a certain threshold, having assets below a certain threshold. In general, it can be about $2,000 for individuals. And then for long-term care services, people would also need to have a certain level of need for assistance. For example, they might have to have a need for help with multiple daily activities such as eating or bathing or dressing in order to receive services. The other thing that's important for people to know about Medicaid is that it has what we call an institutional bias. Under the law, Medicaid is required to pay for nursing home coverage, but Medicaid is not required to pay for coverage for people to receive services in their homes and communities. Most states do provide some coverage for individuals in their homes and communities. However, that coverage is often limited and it's considered optional. There may be a waiting list for services. Individuals may not receive all the services that they may need. So there is a need for some changes in federal legislation to help make sure that individuals who are on Medicaid can get the home and community-based services that they need. Because these services, as we talked about, are really where people want to be, and they're also cost-effective. In general, for each person that's in a nursing home, an older adult or an adult with a physical disability, you can serve 3 people in the home and community.
We are working to reform the delivery of health care in this country. How do you see, or what is your desire to have a change as it affect, in respect to our senior population?
Sure, and that's a great question. Healthcare reform is really an opportunity to address a number of important issues that older adults are facing every day. AARP is focusing really on sort of 6 key priorities and areas to help older adults in healthcare reform. The first one is making sure that we have affordable healthcare coverage for individuals who are in the 50 to 64 population, so sort of the individuals before they're eligible for Medicare. Coverage is often very expensive for individuals in this category at this age because they may have pre-existing health conditions that make insurance more expensive for them to get, or they may not be able to get it at all due to these pre-existing conditions that they might have. And often individuals, employers may drop retiree health coverage, or individuals in this economy, especially older adults, are losing their jobs and often with that losing their access to their health care coverage. So we want to make sure that there are affordable health care choices for